grading rubric. No rating on anything. And we're gonna get started. Knock, knock, knock.
Hello.
Hi, my name's Brittany. I'm a student nurse from Saginaw Valley State University. I'm here to do a head-to-toe assessment on you. Is that okay?
Yep.
All right. So I am washing my hands. Can I get your name and date of birth?
Zoe Bragg, 12/19/2006.
Okay. And where are we at today?
Doctor's office.
Okay. And what holiday did we just celebrate?
Thanksgiving.
Perfect. So you're A&O times 3. I am comfortable moving on with my assessment. I'm going to ask you a few general health questions. Are you taking any medications?
No.
That includes vitamins or over-the-counter herbal supplements?
No.
Perfect. Do you have any allergies?
No.
Do you have any past or current medical conditions that we should be aware of?
No.
Any family history, including diabetes, heart disease, high blood pressure, thyroid, stroke, anything like that?
No.
Okay. Any surgeries for you
No.
in the past? Okay. Tell me about your diet.
I say it's pretty good.
Pretty good. You eat a lot of fruits and veggies?
Yep.
That. Okay. Do you exercise at all?
Yes.
Okay. What do you like to do for exercise?
Walking.
Walking. Do you walk about 170 to 175 minutes a week?
Yeah.
Perfect. That's what they recommend, so keep that up. Do you smoke? That includes nicotine, vaping, and marijuana.
No.
No. Do you drink alcohol at all?
No.
Perfect. I like that. Did you play any sports when you were in high school?
Yeah.
What did you play?
Softball. Volleyball.
Okay. So kind of rough on your knees and your wrists?
Yeah.
Okay. Are you experiencing any pain today that we should be aware of?
No.
Okay. So I am going to move on. We're going to get a set of vitals on you, okay?
Yep.
I'm going to tuck this in here. There you go. We got those kind of arms. One 12/66, so that is normal. Now I'm going to count your pulse, okay? Pulse is 74. 18 for respiration, so that is normal. I'm gonna grab a temperature on you. So I'm pointing at your forehead. 98.4, that's normal there as well. And then last thing I'm gonna get is an O2 reading on you. First I'm gonna see if there's any clubbing on your fingers, and there's no clubbing. No clubbing on these ones either. $95 for your O2, so that is normal. That's good. So now I'm just gonna start with my assessment, okay? I'm gonna start with your hair. Any history of head lice that we should be aware of?
No.
You do got some dandruff, dry skin. Is that normal for you this time of year?
Yeah.
Okay. No lesions or abnormalities noted there. I'm just gonna palpate it. Any pain or tenderness with that?
No.
Okay. I'm gonna feel for your occipital lymph nodes. Any pain or tenderness there? Perfect. I'm just gonna finish up with my lymph nodes. We have your pre-auricular, any pain or tenderness?
No.
Your post-auricular, any pain or tenderness?
No.
Okay. Your submandibular, any pain or tenderness? Submental, pain or tenderness? Perfect. I'm gonna have you go like this. Supraclavicular lymph nodes, any pain or tenderness there? Cervical lymph nodes, any pain or tenderness there?
No.
Perfect. So lymph nodes are normal. There's palpable, no tenderness though. I'm gonna check tissue trigger, or turgor I mean. No tenting, so I'm not worried about dehydration there. Now I'm going to palpate your frontal sinuses. Any pain or tenderness?
No.
Okay. Your maxillary sinuses. Any pain or tenderness?
No.
Okay. Now I'm going to look at your ears. Okay.
Yep.
Just gonna look inside them. No drainage, no obstruction. A little bit of earwax is noted. Any tenderness when I do this?
No.
Okay. Look at this one as well. No obstruction, no earwax or drainage in this one. Palpate them. Any pain or tenderness with that?
No.
Okay. So that's good. Now I'm gonna move on to a couple of eye tests on you, okay? So first I'm just gonna pull down on your skin here. You look up, good. And then look down, good. So conjunctive is pink. Your sclera is white. That's normal. We want that. Now I'm just gonna shine some light in your eye. You can just look at me when we do it, okay? Good. Good. Just gonna reflect the light off of your nose into your eye, okay? Perfect. And then follow my pen light with just your eyes, okay, without moving your head. Okay, good deal. Any like discomfort when you did that?
No.
Okay. So then I'm gonna have you look at my pen light, look at my hand, look at my pen light, look at my hand, look at my pen light, look at my hand. Perfect. So your eyes are perla. I tested your cranial nerves 3, 4, and 6. So that was your oculomotor, your trochlear, and your abducens. Those are all intact, so I'm not worried there. This is part of the cerebellar function that I'm going to do right now. I'm going to finish it up in a later step, okay? So I'm going to have you touch your nose, touch my pen light, touch your nose, touch my pen light, touch your nose, touch my pen light. Perfect. Now I'm going to move on to your nose, okay? So I'm going to have you plug one side, take a nice deep breath in and out, and then other side, in and out. Any troublesome with that? Okay. Are you experiencing any congestion or trouble breathing today? Okay. So now we're gonna check your cranial cranial nerve 1, your olfactory. So I'm gonna have you close your nose. I'm gonna have you smell something. If you can smell it, just tell me what it is, okay? Coffee. Perfect. So that's intact. That's good. I'm just gonna look inside of it, okay? No deviated septum, no pileups. Mucous membranes are pink and intact. Now we are gonna move on to your lips. They are pink, just a little bit dry, probably normal for this time of year. Okay, so now we're gonna look inside of your mouth. I'm gonna have you stick your tongue out first though, and then move it side to side. So that's cranial nerve 12, your hypoglossal, that's intact. And then go ahead, open your mouth up, stick your tongue out, just looking, inspecting, seeing if I see anything abnormal, which I don't. Everything is pink, moist, intact, no lesions or anything. Good. Okay, go ahead and swallow if you need to. And then we're gonna have you open your mouth out, stick your tongue out, and then we're gonna say ah, okay? Perfect. So uvula goes up and forward, soft palate moves. That's cranial nerve 9 and 10, your vagus, and your glossopharyngeal. So that's good. All intact there. Now we're going to do cranial nerve 5, your trigeminal. Okay, so that's just right here. I'm gonna have you open your mouth, close it, open your mouth, close it, and then clench your jaw. Okay, and I'm gonna touch your face with Q-tip in a couple different places with your eyes closed, and you just tell me where you're feeling it at. Okay.
Forehead, nose, chin,
Perfect, so that is intact. Now we're going to do cranial nerve 7, which is your facial. So I'm gonna have you smile, frown, puff your cheeks out. Perfect, that's intact, so I'm good there. Now I'm gonna move on to your neck, okay? No discoloration in your neck. I'm just gonna feel for your trachea. It is midline and no deviations. That's good. I'm gonna palpate your carotid arteries one at a time, okay? That's good. I'm gonna do this side. Good, they are symmetrical. Now I'm gonna listen to them, make sure you don't have a bruit, and a bruit is what we don't want. It's an obstruction of blood flow, okay? No bruit noted there. No bruit noted there, so that's good. Now we're gonna move on to your arms, okay? Just wash my hands real quick because I did rub my nose. Alright, so I'm gonna pull them up. I'm gonna inspect them first. So just got a couple moles here, maybe some dry skin. Any changes in size, shape, or appearance of your nose, your moles that you're concerned of? No. Okay. Got a tattoo here. Any concerns or problems with that? Skin is dry and intact. Capillary refill is less than 3 seconds, so that's good. I'm just gonna inspect this one. Same thing, got some moles here. Any changes with those that you're concerned of? Okay. Skin's warm, dry, and intact. And capillary refill is less than 3 seconds, so that's good. Now I'm just gonna palpate them. Any pain or tenderness with this? Okay. Muscle tone is even and symmetrical. Now I'm gonna check your brachial pulses, okay? Okay, good, symmetrical. Your radial pulses, good and symmetrical. Now we're going to test cranial nerve 11, which is your spinal accessory. So I'm going to just have you shrug your shoulders. Okay, can you do it again? Perfect. I'm just going to apply light pressure here. I'm going to have you turn your head that way. Perfect, same thing. Alright, so that's intact. That's good. Now we're going to do some range of motion test on ya. I'm going to have you do a swimming forward motion. Just got some creaking there in your shoulders. Any pain or tenderness with that? Okay, go ahead, swim backwards. Any pain or tenderness with that? Okay, now I'm going to do your elbows. I'm going to have you place them in my hand. Go ahead, bring them out, in, out, in, out. Pain or tenderness with that?
Nope.
Okay. Move your wrist in a circle. Any pain or tenderness with that?
Nope.
Okay. Go ahead, squeeze my hands for me. Good. Put your hands like this. I'm going to push down, you push up. Good. And then I'll do the opposite. I push up, you push down. Good. Go ahead, go like this. And then I'm going to push in, you push out. Okay. And then I'll put my hands in, and I push out, you push in. Good. That's good. We're going to finish up your cerebellar function now, okay? So I'm going to have you do an OK symbol, and then just go like this, and then do that as fast as you can. Perfect. Now we're going to have you put your hands on your legs, flip them over, and then back, and then do that as fast as you can. Perfect. Cerebellar function is good, intact. I'm not worried about balance or anything like that. So before I move on to your back, I just want to look at my rubric here and make sure I got everything. I did want to note that your lymph nodes on this side, they are a little bit palpable in your cervicals. So if you're just starting to feel icky in the next couple of days, just be aware of that. But all your lymph nodes, other ones seem fine. Gonna move on to your back now. I'm just gonna come over here so she can get good thyroid. Is it okay if I untie your gown
Yep.
here? Alright, so can I put my hands around your neck?
Yep.
Alright, I'm just gonna feel for your thyroid gland here. I am gonna push it off to the side, each side, and then ask you to swallow. It shouldn't cause discomfort, but let me know if you do have it, okay? Alright, go ahead and swallow. And then swallow. Perfect. No enlargement or nodules noted there. No discoloration in the neck here. And then you're not using any accessory muscles to help you breathe. I'm gonna check your AP ratio and then get a good baseline of your bases, okay? Alright, go ahead, take a nice deep breath. Alright, so you have 2-to-1 AP ratio, so that's good. I have a good baseline for you here. I am noting that your skin is warm, dry, intact. You do have a couple moles and a little bit of acne. Do you have any problems there with those or any concerns? Okay, spine is midline. So we do have to listen to your lungs in a few different places. It can be tiring, so just let me know if you need to take a breath, okay?
Yep.
So we're going to do a full deep breath in and out for each one. Okay. Okay. Last one on this side. All right, lung sounds are clear. Now I'm just going to do a couple light tappings in the same spots that I did listen to your lungs at, okay? And you can
Yep.
just breathe normal for this. All right, so that's resident, that's what we want, that's normal, and that ends my redo.